Keep it coming, keep it coming. We will stop on the here. Oh, she's online. Great. Okay. Thank you.
Hi, good afternoon, everyone. Oh, thank you. It's a pleasure to be here today. My name is Rosemary Adeola Abimbola, and I am a registered nurse. And I just want to use this opportunity to thank the organizers of this event. Thank you for this honor. I'm so grateful. And I would also like to say a very great shout out to my best friend, Yeka Ojo. Thank you very much. May God honor you and may your name be mentioned in great places and higher places in Jesus' name. Because of our time and because the time is really short and the topic is a very broad one, I'm going to quickly go straight to the point. And the topic before me is women's mental and sexual health. It's something we are familiar with. It's something that we've been doing, we've been practicing, we know about it, but we just know it as, oh, when it comes to sexual health, everybody have that idea, oh, they're talking about sex. But sexual health is more than sex. It's not just about sex. So I'm going to be talking about it's a two broad topic. It's a mental health and it's a sexual health. So the two are interrelated and interwoven. So I'm going to be talking about the sexual aspect first, and that is the sexual health. Sexual health, like I said, is not just about sex. It's not just about meeting with your partner, having that intimacy. Sexual health, according to WHO, is defined as the state of your physical, mental, and social well-being in relation to your sexuality. And that is why I said the two topics are really interrelated. So according to WHO, they went further and defined it as having a positive and respectful approach to sexuality, to relationship, and to pleasure without being forced or coerced, discriminated, and also without being abused. That's what sexual health entails, and that is the idea I want us to understand and bring into today's topic. So sexual health involves ability to be intimate with your partner, to communicate with them explicitly, clear and concise. You have to be open with your partner and about your sexual needs and desires. When I said sexual needs and desires, it means you must be sexually functional. You must become aroused. You must have desires, become aroused, and sexually fulfilled. That's what sexual health is. And what are the factors? What do you think are the factors that determine our sexual responses? A lot of factors influences our sexual responses. And the first one is your relationship with your partner. The way you communicate with your partner, the type of bond you have with your partner determine how you respond sexually to him or her. So your relationship with your partner is one major factor that determines your sexual response. If you have an open and honest, genuine relationship with your partner, you have a positive and respectable approach to sex when it's time for this. Aside that, there is also past experience. Some people have terrible past experience. For instance, people that are molested or raped when they are young or even as an adult, they have terrible experience when it comes to sexual responses. And also the way our body works as women, the way your body, your feelings and your emotions. If you're in a sad mode, low mood, you're not happy, you will not be happy to be intimate. Your response to sex will not be too good. So apart from that, let's look at the factors that influences sexual health from women in our own let me say with our own gender. What are the factors that influences sexual health? The first one that is more related to women is the hormonal imbalance. Hormonal imbalance plays a major role in sex. For instance, as we grow older, our estrogen level tends to drop as a woman. As we grow older, from age, I think from 10 to like age 35, we have high sex drive. We have high sex urges. But once we are going to menopause, the estrogen level continues to drop from age 40 to like 55 downward. The estrogen level continues to drop. And how does estrogen level works? The lower your estrogen level, the lower the sex urges or sex needs or arousal you get. It's just like you're putting your hand in ice. You won't feel, it got to a point that you won't feel the sensation on your palm again. Or let's say, for instance, during the winter period, your hand is outside, you're not wearing a glove. You lose the sensation on this palm of your hand. You lose it. It becomes like there's no blood flow. The same thing happens to estrogen level. So when the estrogen level drops, there will be less blood flow to your genital area. So it becomes very difficult to get you aroused, and before you get real orgasm. Do you understand? So hormonal imbalance play a major role in women's life, and that's why you see women during their menstrual period, we call it PMS, premenstrual syndrome. They become more irritable. There'll be mood swings. You see, they'll be cranky. A lot of symptoms comes out from that aspect when they are during menstrual period. And during that period, before menstrual period, if a week before the menstrual period, there will be decrease in estrogen level. And that is why you see all these signs and symptoms coming out. You see irritability, anxiety, you see difficulty in sleeping, headache, a lot of factors, a lot of symptoms come out into play. Now, apart from let's move from premenstrual menstruation period to childbirth. After childbirth, women have this traumatic experience, especially when you experience induction of labor or even CS or any childbirth is not easy. So you see a lot of factors, a lot of stress on mothers. So it also affects their way of sex. It also affects their sexual health. Apart from that, let's go to the menopause time. If you ask our mothers or someone that is passing through menopause, you will see that their mental health are usually very affected. Most women have increased BP during this period. You see them having sweating, headache, a lot of physical ailments start popping up when it comes to menopause. So you see a lot of crankiness, depression. The depression and anxiety rate increases during this period. That is hormonal imbalance. Now, let's leave the hormonal aspect. Let's talk about the physical aspects. There are some certain illness, like long-term illness, that also influences our sexual health. For instance, hypertension. Hypertension play a lot of role. That's why most people say it's a silent killer. It plays a lot of roles or a lot of influence that in influencing our sexual health. There are some medications that you are given when you are hypertensive, like your diuretics. I don't know how to say it the non-medical terms. Like there are some hypertension medications that decreases your sexual drive. And apart from hypertension, some people that are having mental health illness, like maybe depression, anxiety, there are some antipsychotic medication that also, in fact, one of the major side effects of antipsychotic medication is the sex low libido. It decreases libido. So there are some physical ailments that affect sexual health and sexual needs. Apart from the physical ailment, let's go to the psychological and social illness. I'm so sorry, I'm trying to break it because my time is really short and I want to make sure I touch every aspect. The psychological aspect of or influencing the sexual health is the history of sexual abuse. For people that are raped or molested, or maybe one or two things that have happened to their sexual life while they are growing up, they tend to have low sexual drive. For TCC women, TCC means trying to conceive women. They don't enjoy sex as they ought to do. They are just having it for sake of, I want to have children. They are under demand and pressure, so they are under worriness. So it also affects their sexual life. They are just doing it just because they need to give birth on time. You understand? So apart from the physical, the hormonal, and the psychological factors, we have the cultural and religious factors as well. There are some culture that mutilate female children, that is female genital mutilation. They mutilate female children, and once you are mutilated as a female, you find it very difficult to get aroused when you're having sex. So you have to, your spouse might need to do more